Starting position for ULTT3 is same as ULTT1. So the patient lying in a supine lying in the middle of the bed. So if you can ask you to slightly come down, just slightly come down, slightly come down. So much. The starting position is same as ULTT1, the patient lying in the middle of the bed. So the therapist standing position is the starting position is same as ULTT1, facing the patient as well. So for ULTT3, if you can ask, shuffle towards me, just a little bit more, yeah, that's great. So ULTT3 is very specific test to check the mobility of the ulnar nerve. You got me, yeah? It's specifically to test the mobility of the ulnar nerve. So as soon as the elbow comes out of the plinth, you're going to use your thighs to create the abduction of the shoulder. And then one hand goes and stops the shoulder from elevation, and you're going to use your thighs to create that kind of an abduction of the shoulder. You got me, yeah? You're going to create that kind of, use the thighs to create that kind of abduction of the shoulder. So you abduct the shoulder to 90 degrees, external rotation of the shoulder to 90 degrees. So it's not maximum external rotation, it's external rotation up to 90 degrees of external rotation. Once you externally rotate the shoulder to 90 degrees, you pronate the forearm, and then you extend the wrist and then the fingers. So you pronate the forearm, extend the wrist and then the fingers. After you pronate, after you extend the wrist and the fingers, then you simultaneously abduct the shoulder and flex the elbow. Is it okay, Joe? I can ask you to bend to the opposite side, Joe. Does it increase? Mm-hmm. Come back to the same side and come back. You got me? You with me? So I'll repeat. So the first, stop the shoulder from elevation, abduct the shoulder to 90 degrees, pronate, externally rotate the shoulder to 90 degrees, pronate the forearm, extension of the wrist, extension of the fingers, extension of the thumb, and then it's a simultaneous abduction with elbow flexion. Okay? And then once you take it to the end point, you ask the patient to side flex to the opposite side and then come back. If the symptom reproduce onto the little finger, if the symptoms reproduce onto the ring finger, and if it goes down to the inner side of your forearm, then that confirms you're definitely stretching the ulnar nerve. Same as any other test, you need to look for three factors. You're looking for the pain provocation, you're looking for the range of motion, you're looking for the resistance of the end range as well. So the resistance you're looking for is the flexion of the elbow. Got me?
Did you say symptoms on the inner side of the forearm?
If the symptoms reproduce onto the little finger and then the ring finger and down to the inner side of the forearm, and that confirms you're definitely stretching the ulnar nerve.
Right.
Yeah?
Yep.